Good afternoon, ladies and gentlemen. It's my pleasure to introduce today Dr. David Rothwell, Assistant Professor in Human Development and Family Sciences here at Oregon State University. Dr. Rothwell received his MSW from Tulane University and a Ph.D. in Social Welfare from the University of Hawaii. His research interests include poverty, families, and social policy. In his work in these areas, he aims to understand the mechanisms driving social and economic inequalities. Further, Dr. Rothwell's research involves cross-national comparisons of policies and institutional frameworks contributing to poverty, economic inequality, and associated health consequences. His research has been funded by the Social Sciences and Humanities Research Council of Canada, the Canadian Institutes of Health Research, the University of Wisconsin Institute for Research on Poverty. Today, Dr. Rothwell will be speaking to us about his research on the Oregon Poverty Measure, creation, and preliminary findings. David.
Thank you, Rob, for the generous introduction. And I also want to say a couple words to introduce co-author Leanne Giordono, who is a postdoc here with us. And we're going to share the time, and it will involve an awkward mic transition about halfway through. But Leanne, we're very thankful to have Leanne. She is a recent graduate from our Oregon State School of Public Policy, and is doing a lot of interesting work on looking at policy processes and keeps our team thinking about the institutional frameworks and policy processes and how those shape the outcomes we're studying. So we're really lucky to have Leanne with us, and looking forward to hearing her talk. We're going to share the talk. So today we're talking about the Oregon Poverty Measure, and I want to say a couple things to kind of ground us and get us started. The first one is that this is going to be a kind of population level talk. So a lot of my colleagues and friends in the crowd are studying kind of things at the micro level, or how poverty might affect individuals in kind of a clinical sample or field sample. And this is really a study and an effort to understand population level or social macro level things like the poverty rate. What makes the poverty rate go up or down? So I want to situate, I want to make sure we're all on the same page in that regard. And it reminds me of a funny story. I was sitting down with Javier right when he arrived, and he was getting to know his faculty, and he was sitting down with me, and we were talking about he wanted to know what kind of work I was doing, and I told him, kind of this idea that we're pushing forward on how to create a better poverty measure in Oregon. And he kind of looks at me, he's like, oh, well, in epidemiology, people have been debating this for years, and he kind of looks at me and says, do we really need another study of poverty? And I'm thinking, oh, geez, what did I get myself into? Here's this new dean, he doesn't want to support my work, but so after a couple sleepless nights, I did get to know, I've been pleased to get to know him, and he's a great supporter of this work, and if he were here in person, I'd thank him. So population level, the second thing is that this is really a nice transition from last week's talk. If anyone was here to hear Bruce Goldberg talk about the evolution of healthcare reform in Oregon. So that talk, really one of the main takeaways for me was on a need to better understand the social determinants of health and the relationship between things like healthcare spending and social spending. And catchphrases like your zip code determines your health more than anything else. And so here we are a week later talking about one of the major sources of economic and social inequality, and that is poverty. So this sequence, I don't know if Marie intended it that way, but the sequence of these two things is nice to go together. The last thing is that this is really, as the title suggests, preliminary. This is our first time talking about this project. Leanne's been working full-time for about 6 weeks. And so we're happy and excited to share some new things in public, but we're very much at the beginning, and so therefore very much interested to hear your thoughts and critiques, comments, and how we can improve this. So we'll go ahead and get started. This is kind of what we're going to talk about. you're being warned that we're going to take a deep dive into how we measure poverty in this country. Things my students could probably cover just as well as I can by now. We've been talking a lot about this in class. We're going to talk about the Poverty Measure Project itself, some of the details that we've been working on, and then at that point we're going to shift and Leanne is going to talk about why this all matters. Okay? So, I want to start off getting us oriented on poverty and talk about how poverty measurement is a controversial subject. So in 2014, the Council of Economic Advisors to President Obama, reflecting on the war on poverty, said that the main lesson that we can learn is that policies and programs can lift people out of poverty. And then they say poverty rates have fallen from 26% to 16% over that period of time that they were interested in, a 40% decline. Okay, that's one interpretation. Then Speaker Paul Ryan, a couple years later, came out and said, essentially we haven't made any progress against poverty. He says, we've spent trillions of taxpayer dollars over the past 5 decades. The poverty rate, the official poverty rate, went from 14.8 to 14.7 to 14.8, and these programs have helped a lot of people, but we haven't really made any progress at all against poverty. So, I just want you, the things we're going to talk about are controversial. Some of them have political motivations and angles to them. So we're gonna get to the bottom of these 2 measures, though, I promise. So, what is poverty? It's really pretty simple. It's this simple equation simple definition of insufficient resources to meet some level of threshold over a given amount of time. Now, most people, when we think about poverty rates, the time component is the easiest. That's usually a year, but there's a lot of debate about how to measure those resources and how to set those thresholds. And that's where most of the Oregon Poverty Measure Project and what we'll talk about today is centered on these controversies. So just to orient you, the official poverty measure, this is the measure that Paul Ryan mentioned. This is the measure that you read about in September when there'll be an article in the Oregonian saying the poverty rate went up or down by 0.3 percentage points in a given year. And in that definition, the Census Bureau considers individuals who are related by birth, marriage, or adoption, considers these to be families. Okay? We assume, kind of underlying this, I put it up here just to make sure we're all on the same page, is that people living within households share resources. How much they share is debatable, but poverty is a kind of household condition. So we make assumptions that 2 parents and a child are going to be sharing certain resources. I'm sure some of you, especially my HDFS colleagues, are thinking this definition of family might be a little bit limited, and I'll come back to that in a second. Okay, so what about resources? The primary one we talk about is income, and we'll get into this. I just want to mention there are things like assets and wealth, consumption, and ideas of material hardship that also factor in our discussions, but these are not official poverty measures. These are aspects of economic hardship, but not poverty per se. Okay, so back to the official measure. The official measure considers pre-tax income. So if you think about all the things that affect your economic well-being, this is part of them, but it's probably not the whole picture. So earnings, investments, and some transfer programs. This is the official definition. Levels of need. This person, Molly Orshansky, created the first poverty thresholds back in 1963, and she was a Census Bureau worker. And does anyone know how the thresholds were originally created? Karen?
Basically, she was Polish, and it was based upon the amount of money needed to cover food.
Okay.
Back to my
I'm not sure what the connection is between being Polish and that, but
Because she had lived during the famine after World War II,
Okay.
and so food was really salient.
okay. Okay, good. So yes, that's correct. Molly Orshansky took the best data at the time and said, how much does it cost a family to put food on the table? And with her colleagues, they said, well, we're just going to times that by 3, and that would be the poverty threshold. And so that methodology has maintained to this day, and it's been adjusted for inflation. So to kind of anchor it in today's terms, if you look here, I don't know, if you think about a family of 4, the official poverty measure threshold is about $26,000. And so, you know, if we had more time, I'm curious what you think about these, but anyway, this is how these thresholds have been created. So you take that pre-tax income divided by your poverty threshold, and if you're above or below that, then you're above or out of poverty. And this is the absolute poverty rate, or the official poverty measure, as measured in Oregon over 26 years. And so maybe you're seeing this and thinking, maybe Paul Ryan had a point, that we haven't moved the poverty rate up or down much, right? So this is kind of the baseline, or kind of the starting point for the study of poverty in Oregon. Okay, now I'm going to go through a series of critiques of the official poverty measure, and we can think of these in traditional measurement terms of validity and reliability if we want. But the first one is that there are problems with the threshold. So, the threshold itself, not even, we'll get to the fact that adjusting for, or multiplying cost of food times 3 is a problem, but just the threshold itself has eroded over time when we adjust for inflation. So in the 1960s, when the threshold was originally started, that threshold was around 45% of the median income. Fast forward, if you just look at the blue bars, there's a lot going on in this graph, but if you just look at the blue bars, it's now down to around 30%. So the threshold's position relative to the income distribution has eroded over time, if that makes sense. Basically, for a lot of different reasons, consumption and food patterns have changed a lot over time. That's one problem. Second problem, as I was kind of highlighting, is the definition of family. Cohabiting people, you can think of people who are living together, sharing resources, paying rent, planning for the future, having children in some cases. These people under the official poverty measure would be treated as separate individuals or separate households. And we know, again, a lot going on, but if you just look here, this is saying that over the past 30 years, the percent of women who cohabit has doubled in a pretty short amount of time. So we know we could talk for 2 hours just about changing family demographics, but this is just one slide on the topic, that families have changed over time and we need a different definition of family. Problem 3 is that policies are missing from the official poverty measure. So unless you read about these things a lot, you probably didn't pick up on that pre-tax income thing that I mentioned before, but what this graph shows is the changing safety net. So you see the orange line, this is over time, 1970 to 2010, and this shows the public redistribution of the Earned Income Tax Credit program. So it's gone from almost no spending up to the second most important social welfare program we have, social assistance program. And all of the resources that are redistributed from the Earned Income Tax Credit are not factored into the official poverty measure. Neither is SNAP is here somewhere, the number 1 program. SNAP or food stamps also not included in the resource bundle. So we're not really getting a full picture of a family's economic resources if these things are not included. Fourth one, and this one matters a lot to all of us who live in the West here, is there's no geographic adjustment in the official poverty measure. So if you live in Manhattan, Kansas, or Manhattan Beach, California, your poverty threshold is the same. It's $26,000, even though it costs a lot more to live in California than it does to live in Kansas. And this map is just showing that variation of housing costs to income across the country. Okay, so those are the four main problems. Thankfully, there's a new measure called the Supplemental Poverty Measure that was introduced in 2009. You know, a kind of previous generation of scholars who studied this topic advocated a long time to get this measure introduced. And in 2009, the census started doing that. They adjusted family to include cohabiting people and foster children. They adjusted the threshold. So rather than anchoring it in the 60s, they said, we're gonna calculate things on a 5-year moving average, and so we can understand that threshold changing over time. They included resources like SNAP, EITC, the main programs I mentioned, but they also included taxes. It doesn't make much sense to think about your resources before taxes are taken out, right? So the new measure does that. It also considers important things like childcare, child support, and one of the things we're starting to think about more and more is what are called medical out-of-pocket expenses, or MOOP, is what people talk about. So the new measure accounts for these, right? As a better information on resources and thresholds, and last but not least, it adjusts for different living conditions across the country. Okay? It's not a perfect measure. There's we can think of ways to improve it, but in a lot of areas, we do think it's moving closer to the real meaning of poverty. So this was started in 2009. Some people at Columbia have gone back and made these archived SPMs available. So this graph shows the official poverty measure and then the supplemental poverty measure over time. And at the biggest gap here, it's about 5 percentage points difference. Here you're looking at 1 to 2 percentage point difference. The SPM always being higher. So a takeaway is that you can think of if we have a better measure of poverty, there's a little bit more poverty than we would normally think. Okay, that's fine. But there are some empirical kind of data problems with the SPM. The first one is that it's based on a survey that does a really good job of asking detailed questions on income, income and expenses and all the things necessary, but it's a pretty small sample. So if we think of Oregon, in a given year, it's about 2,500 respondents. And that's just not big enough to provide a lot of detail when we're interested into lower level geography. So if you think about this, to get all the rates you see here that I'm presenting are 3-year averages. So to get the rate for, actually some of them are 5-year averages. So they're at least 3 and up to 5. But to get the poverty rate for 2013, we would average it with 2012 and 2014 at a minimum. Okay, because we have to pool all this data together to decrease our margin of error and to get a real good understanding of how much poverty there is. So another major problem is that counties are not identified in the CPS. So even our biggest counties like Multnomah and Clackamas County are not even identified. So we really don't know much from what is produced in the SPM data I showed on the previous graph. There's another problem that we're not gonna have a lot of time to talk about today, but people are starting to match survey records like this with administrative data. So this is with actual dollars that are going out the door that the state keeps pretty good records on. And it's kind of problematic, the difference between those two. We've seen some work, like some of that cited here, is showing that when you look at the dollars going out the door from a state like Oregon on TANF, the major welfare program, and you look at what people supposedly reported on a survey, they're underreporting by about 50%. And so this is kind of at the frontier of this kind of work, is how do we correct that? How do we get a better understanding of what's going on? We're working on that as well, we're thinking about it. So poverty in Oregon, this is the OPM. So when you'll see a lot of maps like this, it's almost every day, if you're looking for it, you'll see something referenced in the media about poverty, and it's almost always the official poverty measure. And I just told you the 4 main problems with that measure. We know it's not capturing a lot. Here is from our Rural Communities Explorer program in our college, which is doing a great job, just showing variation by county. Benton County, the 3rd or 4th highest poverty in the state, on the OPM. So this is, we're certainly viewing this with skepticism because we don't think it's a very good job of representing poverty. Okay, now you all can go home knowing a lot more about poverty measurement than you came in with. Sorry to do that to you, but it sets it up. We need to do that to get to where we are for our project. So basically, I've told you about the OPM and the SPM, and what we're going to be doing in the Oregon Poverty Measure Project is to create an SPM-like measure for Oregon, but with lower geographic detail. And so we're going to use a bigger survey, the American Community Survey, that identifies most counties. And then we're going to change the family units, and we're going to make SPM-like thresholds in that data. And we're going to improve the resource measurement, as we talked about. We're going to factor in things like SNAP and EITC. And we're also partnering with the Oregon Department of Human Services, Employment Department, Housing and Community Services. We're using a bunch of other data sources. We're up to 6 or 7 right now, but we think it'll be upwards of over 10 different polling sources in to make our kind of analytical data set to create this measure. And we'll be building on examples from Wisconsin and California who have done this. Each state does it in a little different way. We're hoping to get this administrative data will be different from the other states. I should say that this is made possible from funding from the Providence Health Foundation and the Ford Family Foundation, and I know some of you are in the room who made this happen, and I really appreciate it. And this funding is supporting Leanne's time to really pull this project off. So I will say that just kind of pausing for a second, our goal with this project is to create a hub or a repository of the best poverty and inequality data in the state of Oregon, so that when people in the future want to understand what's going on this topic, they can come to Oregon State, they can come to our college to get this information. And so this is something that we see, not just, we have funding for 2 years right now, but we see updating this, in the future and being a resource for the state as part of our land grant mission and so on. So that's what we're doing. I just want to show a couple things that I think, again, these are like hot off the press, like a couple days ago. We have just produced these, and so I mentioned we're able to link that SPM over time. How does that look like in Oregon? We can show you a little bit. So this is that OPM line I talked about, and if we kind of treat apples to apples here and adjust the SPM, we see a different pattern. So This has never been done in Oregon. I know it's just a simple line graph, but to my knowledge, like no one has seen this before, so it's exciting to us. And so this gets back to the first quotes I mentioned, right? Like, you can look at the red line and in kind of Paul Ryan terms, you can think about how poverty went up 2 percentage points over this time period. Or if you look at the SPM, it went down by 5.4. So just to put a kind of magnitude on this, Oregon is a kind of smallish state of 4.1 million people. So for every 1 percentage point in the poverty rate, you're talking about 41,000 people, right? So when you see up or down, you can do the math. Okay, so now I want to focus here in the latest data. No difference. The red bar is the OPM, the green bar is the SPM. There's essentially no difference there. When we look at subgroup differences, though, we're going to unpack this a little bit and see some interesting patterns that I think some of you will be interested in. So for children, if you were to look, the official poverty measure would say poverty is around 18% of kids. It's troubling to many of us. When we look at the SPM, it's actually lower. It's around 13%, or about a 5 percentage point difference. That's about 45,000 kids who you think would be poor in OPM who would not be poor in SPM. Okay? Older adults, the exact opposite. Okay? So for older adults, we start at a poverty rate with the OPM, the official poverty measure. When we factor in things like geographic adjustments and the medical out-of-pocket expenses, the poverty rate goes up. It almost doubles. That's a big difference. And I think it's around 32,000 older adults would be poor that we didn't think of them as poor before. And there are rural differences when we do that adjustment for living in rural places. The cost of living, when we adjust for lower cost of living in certain places, the poverty rate goes down slightly. Okay? Just one more graph for me, and then I'll turn it over to Leanne. This is just showing that the composition of who is poor also changes. So this is all about rates. That's what you primarily read about, the poverty rate of Oregon or of older adults or rural poverty. But poverty measurement changes the composition of who is poor as well, right? And this aligns with these findings that children, when we use the SPM, constitute fewer of the poor population, and older adults constitute more. So I've tried to make a little bit of a case for why measurement matters for understanding this condition and why we need a better measure in Oregon. But this is not the ultimate end product. We're not doing this just for measurement's sake. We're doing it because there's major policy implications in our ability to understand kind of downstream economic and social well-being is connected to this, and that's what Leanne's going to talk about now.
Great, cue the music.
Yeah.
Thank you. You have them. Yes, right? Okay, good. So, as David, you can hear me? As David just said, what I'd like to do is kind of open up the box a little. We've been drilling down on poverty measurement. Now I'd like to think a little bit about how this fits into the bigger picture, how it fits into safety net programs and social policy at a larger level, and also just bring in some more information about the Oregon context. And a lot of you will know parts of this, some of you may know all of it, and some of you probably know a lot more than I do about pieces of it. But I think it kind of builds the case for why moving into an SPM for Oregon, why Oregon is a good place for that, and why we might want to do that here in Oregon. So, thinking about again, still going back to Oregon poverty and kind of drilling in on what is it like in our state? What are some of the important elements for understanding poverty? Well, we want to understand a little bit about safety net and social policy trends, what's going on both at the federal level, because we understand that Oregon mirrors, we mimic in many ways what's going on at the federal level, as many states do, most states in fact, just because of the way that policies are structured. But we also have some unique things going on in Oregon. And some of those things include high and rising costs related to housing, childcare, medical care, those kinds of things, as well as access to services. And then finally, as David alluded to or actually described, and I'll go back to again, geographic variation. We know that we have it here in Oregon, and so what would it mean to be able to understand more about what our state looks like with respect to a new poverty measure? So the safety net, I'm just going to describe it a little bit to you. This is a term that's been used for a long time, as many of you know. The composition of the safety net includes a lot of different programs, and this is not even an exhaustive list. There are more than that even. But this includes some of the major ones and some of the unique ones. Income assistance is a big part of it. There's a lot of acronyms here, but David talked about the Earned Income Tax Credit. That's a tax credit program. TANF and SSI are both cash-based assistance programs. Food assistance is important. SNAP, or what was formerly called food stamps, as well as women, infants, and children. Those are food assistance programs so that people have access to high-quality food. Housing assistance is part of the safety net here in Oregon and at the federal level. Section 8 housing, that's rental vouchers, and that's funded and administered by the federal government. Energy assistance, LIHEAP, that's here in Oregon, funded by the feds and administered by the state self-sufficiency program agency. And then caregiving assistance is not traditionally considered part of the safety net, but certainly in the last decade or so, a little bit longer than that, as some of these social policies have moved towards emphasizing employment, we've also started thinking about what kind of caregiving assistance needs to happen. So here in Oregon we have the employment-related daycare program. Again, it's sort of a federal state cooperative system for providing caregiving assistance for childcare. There's also a number of programs that are related to caregiving for other dependents, adult dependents, tax credits and other kinds of programs. And then finally, healthcare. I put an asterisk there because healthcare really, as I think David alluded to, has not at all traditionally been considered part of sort of the social safety net. But I think Dr. Goldberg's talk last week, and we have been talking about this for a while, as well as some other recent publications, have really started moving people thinking about how we can pull in what we know about the medical system and the healthcare system and make it sort of a more holistic safety net. So let's get into that a little bit more. Some of the policy trends that I just want to point out for those of you who are not as aware of them. As David described earlier, there's been a real decrease in cash assistance. That has really gone down over time, especially after the 1996 welfare reforms, trying to reduce the welfare rolls, which was very successful, but it means that that's really not an important part of the safety net anymore. The increase in tax credits, the EITC, has been really important, and actually the state of Oregon also has an earned income tax credit contributing as well as non-cash benefits. SNAP or food stamps have really increased over time, as David showed in the one graph. And one thing I want to say about the tax credits, about the shift to tax credits, the earned income tax credit in particular, is that has really focused safety net efforts on individuals who are earning income. So people who are part of the workforce and earning income, they are eligible for those tax credits. For people in much of our safety net focus has kind of moved away from looking at individuals in deep poverty. So just sort of keep that in the back of your mind. And then also, in terms of Oregon, Medicaid expansion has been important here, as well as in other states. Again, a policy trend that is very new-ish and really influences the way we think about healthcare and healthcare policy and how it influences poverty. And finally, just overall, I think one of the main questions is to ask around poverty measurement is, how can the state use what we learn in terms of administering these programs and making sure that these programs are really hitting the people that they need to hit. And I would argue that really there's been a move over the last couple of decades towards a much larger amount of state and federal cooperation. So we have a couple of programs that are funded and administered entirely by the federal government. Earned income tax credit is one. We have a couple of programs that are funded and operated entirely by the state of Oregon. The Oregon Earned Income Credit is one. But the vast majority of programs are some amount of state-federal cooperation, where there's either matching funds or the feds are mostly funding it and the state is administering. So we have a lot of discretion. The state has a lot of discretion around decisions about eligibility, about resources that go to particular people, about how those resources are distributed, as Dr. Goldberg talked about last week. So I think that also is a really important contextual point. So just getting a little bit into a few more details, a little bit more information about what Oregon looks like. And again, some of you know this, but this is using CPS data, a pooled sample. And basically what I really want to point out, which is, oops, that's not it. Oh, that's not what I wanted. I wanted the laser. Can anyone get me out of this? Thank you. Which one is the laser? Just, okay. Sorry about that. So what I really want to point out is how big SNAP is. So in terms of individuals in Oregon, so for the percent of individuals in Oregon participating in SNAP, that's already over a quarter of our population. The individuals in poverty who are participating in SNAP, that's over 3/4 of individuals in poverty. And again, this is at the individual level. And children in poverty, really almost everyone, almost all children in poverty, which is a success for Oregon. That's been touted in a number of places, that we have really high participation rates in SNAP programs. But it also gives you a sense for, David pointed out earlier, that SNAP is not actually incorporated into the official poverty measure. So that's a problem. If we have so many people who are receiving SNAP, but we're not accounting for that in the poverty measure, seems like there's a gap there in our understanding. And for TANF and SSI, TANF also is a relatively important program, especially for children in poverty, and SSI as well. These are both important programs. One other thing that I also wanted to point out, which David alluded to earlier, is around the underreporting that we know happens in the current population survey and the American Community Survey. So these numbers actually do reflect adjustments. The Urban Institute has produced microsimulation data, which Parolin used to adjust SNAP, TANF, and SSI participation levels in the CPS data, and so we took we basically took his methodology and applied it to Oregon data. So these do reflect adjusted numbers. That said, they're likely still not as high as they need to be, we suspect. So this really gets into, this graph is really nice because where David didn't go was to show you a little bit about, well, what does the safety net actually do? What do we understand about how the safety net influences poverty? So what you see, the red line that you see here, that is, that's market income poverty. So that's basically the poverty rate that people experience when you're only looking at the income from their market-based activity. Their wages, their earnings, a few other sources of income, business income, farm income, things like that. So what we see there is that poverty is, number one, throughout this whole period from 1990 to 2015, is between 20 and 30%. That's fairly high, and of course it goes up right around the Great Recession and then tails off again recently during the economic recovery. So that's sort of one line to keep in your heads, and then we move on and we see this blue line reflects the SPM, so the supplemental poverty measure poverty rate in Oregon. And what you see there is, well, number one, supplemental poverty measure is quite a lot lower than market income poverty and decreases over time, which was also one of the graphs that David showed. But more importantly, what we see is that both of these lines, and in 1990 and in 2015, there's a percentage point, 7.5 percentage point difference, 15 percentage point difference between poverty rates associated with market income and poverty rates associated with the supplemental poverty measure, which essentially represents the safety net. So the safety net is moving 15 percentage points or over 600,000 people at this point in time out of poverty. So that's really important. This is one way to sort of, the nice thing about seeing this graph is you get a sense for how can we actually use this poverty measure to understand the influence of the safety net on poverty. So now I just want to go back a little bit into what makes Oregon unique, what makes this an interesting place to implement this project. So housing insecurity is quite a bit higher in, or not quite a bit, is slightly higher in Oregon than in the US, but over half of the Oregon population faces housing insecurity. So they're spending over 30% of their income on housing. Food insecurity as well is higher in Oregon. It's about 13%, which means that about 13% of people don't have access to high quality, consistent food. Housing affordability in Oregon, as David mentioned earlier, rural housing affordability. So we know that this is comparing the US, so rural America, with rural Oregon. The light blue is rural America. So for incomes that are about the same in rural America and rural Oregon, we see housing value, home values that are remarkably different. And in Oregon, they're quite a lot higher, which of course is good if you are a homeowner and you have that asset, but it's not necessarily good if you're an entrant into the housing market. Childcare costs as well, we're seeing very high childcare costs and potentially issues with access in Oregon. In terms of, so for a family, just an average family, they're spending about 28% of their costs with 2 children on center-based care. If they're in poverty, they're spending 94% of their income on child care, or 70% if it's home-based care. So these are really striking figures, startling figures. Plus, what we know, Dr. Pratt recently produced a report that pointed out the number of child care deserts. So we have child care deserts, so we don't have access to high quality, affordable child care in at least 36 counties in Oregon. Finally, again, this conversation about health insurance. So we know, as Dr. Rothwell pointed out, we know that the supplemental poverty measure is incorporating housing costs, so it's adjusting for housing costs, it's adjusting for work-related child care expenses, it's also adjusting for medical out-of-pocket expenses. What it's not adjusting for is healthcare insurance access. One thing, in Oregon we have actually higher access to a higher percent of our population with access to healthcare insurance, 94%. We also, which is presumably related to the Medicaid expansion associated with ACA. And the supplemental poverty measure does not account for insurance access. So Kornman and Remler, clever people that they are, came up with a health inclusive poverty measure, which actually does account for access to health insurance. It's a nice work that they did, and Zode, who I have no idea how to pronounce the name, actually applied their model in Massachusetts to Massachusetts Medicaid expansion, and found a 1 percentage point impact on poverty. So went from, I don't know the exact numbers in Massachusetts, but it went down by a percentage point related to the Medicaid expansion alone. So that's some sort of, again, this is kind of to get us all thinking about what is Oregon like and what would it look like if we did this work here. And finally, I want to go back to one of the last maps that David showed. Again, this is poverty in Oregon. It's the official poverty measure. Shows that we have variation here, right? But we can't do this with the supplemental poverty measure yet because of the various data issues, the empirical issues that David was talking about. We suspect that we would see variation using the supplemental poverty measure. We suspect that it would be really interesting, that it would be really nice to see, to be able to look both at what's going on in various counties, what's going on with different demographic groups in various counties. and I'm just going to speed up a little here. So again, what don't we know? We don't know. We can't get to geographic variation with this measure, with supplemental poverty measure. We can't do the demographic variation as well, especially when it interacts with geography. But also program participation and the extent of underreporting. Not all of the programs are being funneled in. SNAP is not there, EITC is not there when we use the official poverty measure. So by being able to incorporate these really important programs in Oregon into the supplemental poverty measure and be able to see the geographic variation would be a real step up over what we have. And then a little further down the road, what's really interesting about some of this is that we could start using these data to understand more accurately the influence of various Oregon policies, so things like the minimum wage changes that were recently implemented, the Medicaid expansion, as I discussed earlier, the Oregon Earned Income Credit. I mean, that's just the tip of the iceberg, right? As well as the impacts of a variety of Oregon conditions, so labor markets and that kind of thing. We know that there are communities in Oregon that have undergone pretty serious transitions, some of the logging communities. Some of them have done a lot to be able to implement or to strategize around economic development. Some of them have not, and so we could really look at some of the impacts of what's going on in our state and understand it better. So I'm going to oh, no, I'm actually going to tell you a little more nuts and bolts. Sorry, I forgot. Dave got into this a little bit. So we are going to link multiple data sources, as well as try to do some of that adjusting for underreporting. So we really have a much better sense of who's participating in what programs and where. And then finally, we are very interested in this idea of the health inclusive poverty measure. You know, do we see it as sort of an SPM 2.0? And that's where we'll probably turn to some or many of you to get ideas around that and brainstorm around it, because it's new. It's new at the federal level. It's new to us. So we're really looking forward to that. And now it's back to you. Do you want this?
Okay, so that's really it. Thanks, Leanne. We've told you a little bit how to measure poverty, a little bit on the poverty rate has either gone up or down, depending on how you want to interpret it. And then we've told you a little bit about why the safety net matters. Before we take questions, I want to just mention another person who was on the first slide, and that is our colleague and mentor and friend, Bruce Weber, who I didn't get to introduce, but this Oregon poverty measure goes a long way back, much before I arrived at OSU, and I know Bruce has been thinking about this a lot, and much of his ideas, voice, and influence is on these slides that we've been looking at. So that is our Oregon poverty measure. We'll take questions. Yeah.
Thank you very much for the wonderful presentation of your work. A refined SPM is extremely important for understanding the situation of poverty. However, for the policy purpose, particularly safety net and Medicaid, the eligibility are often based on market income. So have you also been thinking about developing a kind of alternative measure for the policy purpose? Because for policy purpose, the SPM can create a kind of a measurement trap, because you include the safety net, but that's precisely how the safety net eligibility is based. And it's kind of the measurement in a similar way, kind of the measurement difference between pre-tax and post-tax. And this is pre-benefit and post-benefit. So I'm just curious, have you been working on the other end?
That's a very good point. That red line that Leanne showed at the end is that market income, and you raise a good point, that eligibility for services should be based on market income, not necessarily what you receive after all of the transfers and after all the benefits of the system. Frankly, no, we haven't thought about that yet. I think it's a great idea to think about how that connects to more health policies, and we hope to do that in the future. Yeah. Denise?
Great talk, both of you. Thanks for doing this. I wanted you to pull that slide back up that was sort of near the beginning that talks about how the youngest and the oldest, the measure flips.
Yep.
I'd love to hear your thoughts about why it does that. Is the one measure including something that the other one isn't? Is it overweighting something or something that you're gonna work on?
Sure.
Tell us a little bit about it.
Yeah, so this is a major takeaway, and this is, you can pull up the 2017 SPM report for the federal, the national report. It will show the same graphs, but these are the first time we've shown them for Oregon. So, child poverty is lower using the SPM. As Leanne showed, and as we know, children in poor families receive SNAP and the EITC, and these things are not covered in the official poverty measure, and we think that largely accounts for a lower poverty rate because more transfers are accounted for. Okay, that's children. On the flip side, we know that older adults experience more medical conditions, and so we think, this is one of the things that we could actually do with the data, given more time, is we could decompose that difference into what's explaining it. But I would hypothesize that it's the medical out-of-pocket expenses that are working in reverse fashion for older adults. Those are picked up in the SPM, and so therefore, when we take income and subtract out all of those medical expenses, people are more poor.
Are you taking in, do the both measures take into account the same amount of health insurance benefits, or do they both not include it? I know when
So
the
the-
second talk was happening, that
Yeah.
sounded like it wasn't.
The red bar definitely doesn't include any of that. And then the SPM includes medical out-of-pocket expenses. So this is a controversial aspect of poverty measurement. And so when you go to conferences devoted to the topic, there'll be 3 papers on just that question, on where do we put such things as medical costs? Do we account for them in the thresholds? Do we account for them in the resources? How do we account for Medicaid? People are actively grappling with where to do this. It's, yeah. Erin?
Yeah, thanks to both of you for that. It's nice to get stuff right out of the lessons. I had a question about, you talked about improving in your new Oregon measure, you talked about improving resource measurement. You didn't talk very much, at least in that overview slide, about improving expense measurement. And I wonder if the SPM just does it better, or whether that's something you're trying to improve as well.
Oh yeah, we're trying to improve that part of the equation as well. I think some of the expertise we have here in the college on childcare is one of the things I'm excited to work with Megan and others on. What do we know about if we can know that by county, we can basically impute that into the ACS and make the adjustment to the poverty rate. Bruce?
So just on the question of health, that's the big unknown in this whole, it's not in the threshold and it's not in the resources. And it needs to be both places, and they haven't figured out how to do that yet. And as their start was just to subtract out-of-pocket expenses from resources. But that's not good. We've got to work on that. So we'll need your help.
Yeah, so both on the healthcare, we think we can improve too, on the healthcare expenses.
This is a broader question, but what do you know from the other states that have moved forward with their measures, or what do you expect in the Oregon context for credibility or political resistance to this sort of a measure? What steps do you have to put in place in order to ensure that it will be accepted and used?
Mm-hmm. Well, I think if we think about the political spectrum, I think people across that spectrum can get behind a more valid measure that picks up more of the underreporting. So I think that is positively seen by most people. In terms of your question about what other states have done,
Wisconsin and
yeah.
Do you know anything about what their experiences have been around any pushback on new measures?
It's a good question. I think most people, first of all, they understand the problems with the OPM. The things we talked about, those are really problematic. And then they want local information. right? So they're quite enthusiastic about trying to get a more improved measure. I haven't heard a lot of political or other resentment. Yeah.
I have some thoughts as well. I mean, I think there's a, politically it can be more of a mess, but I think that there are some inroads. So I think that, for example, the Legislative Research Office could play a big role in sort of use it. And I don't know the degree to which they're currently using SPM, in part because it's really not available to them except when they're citing other studies. But when they're producing legislative reports about analyses about the impacts of making various changes, I think in particular, if they were to get on board with reporting, I think we can't fully drop the official poverty measure because it is official and there's a lot of things riding on it. But sort of reporting both things, or at least pointing out when there are major discrepancies, that might be a potential inroad, because they do care about the data. I'm not entirely convinced that the politicians care as much about the accurate data, but I think the legislative offices do. So I think that's one sort of inroad into getting that information in front of the right people.
I'm wondering if you can speculate about where young adults who are enrolled in college fit into any of this. I know that they're a small subpopulation, but sometimes we think of them as members of their family of origin. Sometimes they're working age adults who just aren't working very much or at all. They're pretty well formally excluded from the safety net. They can't really get SNAP. They probably aren't going to benefit from EITC. And yet, a lot of them are what we would consider low income or poor or whatever terms you want to use. And instead of thinking of that as just like a natural phase of life or something, what does this do to measure, with the supplemental measure, what does it do to young adults who are not in the labor force but are in college, and what are the policy implications of that?
Yeah, it's a good question. They're all over the place, right? Really, when the survey worker comes and asks that person where, is this person living with you, it depends on how they answer that question. I will say that the Wisconsin measure, Bruce, correct me if I'm wrong, but the Wisconsin measure excludes university and college students because of all of these complexities. So it's in the footnotes, but that population is not, just because no one's figured out a way to handle these complexities yet. Not to devalue those, they're super important, but as a field, I don't think we know how to handle those complexities quite yet. I'm getting the sense.
It's like it's 2 p.m., maybe time for one more quick question.
Carolyn?
Doesn't the OEC have a much simpler poverty measure, like 45% of the median income or something like that? And what would the poverty in Oregon look like if we adopted something like that?
It's a good question. I think we have all the tools to do that. It would take maybe 3 minutes to run that line of all the data set up to do it. And I think when we produce a report, we might do that. Interesting, I was at a national conference in November, a panel talking about did we win or lose the war on poverty, and there was all this disagreement. There's a whole other measure that I'm not even talking about called a consumption measure, which tries to show that there's 2% of the population is poor. So add that into the mix. But at the end, a long story short, at the end of that talk, there was consensus across all these researchers that otherwise don't agree that a relative poverty measure such as 50% of the median income would be, and to anchor that over time, would be a reasonable way to study. So it's part of the story, yeah. I can stay around if anyone has questions or.
This is a quick one. It was just basically acknowledging, relative to Stephanie's question, is that it doesn't seem that education costs are ever even considered, and the reality is we're talking about healthcare costs. Now education costs are affecting families and individuals in very interesting and long-term ways, and it's not even talked about. We don't have a truly public education system.
Good point, Deborah. You're absolutely right, and we're going to tackle this incrementally and try and work on childcare costs, and then think about education next.
I would argue from that
The other way.
That childcare cost that I started with when
Yeah.
my child was before school, got way.
Way more. Yeah, sure. Sure.
David, Leanne, Bruce, thank you very much.